Hey students, this is your Nandini ma'am. Today we are going to read chapter number 5, Back, from the book B.D. Chaurasia, Human Anatomy, Volume 1. So let's get started. Introduction. This chapter deals mainly with structures which connect the upper limb with the back of the trunk. Surface landmarks. Number 1. The scapula, shoulder blade, is placed on the posterior lateral aspect of the upper part of the thorax. It extends from the second to seventh ribs. Although it is thickly covered by muscles, most of its outline can be felt in the living subject. The acromion process lies at the top of the shoulder. The crest of the spine of the scapula runs from the acromion process medially and slightly downwards to the medial border of the scapula. The medial border and the inferior angle of the scapula can also be palpated. Figure 5.1. Number 2. The eighth rib is just below the inferior angle of the scapula. The lower ribs can be identified on the back by counting down from the eighth rib. Number 3. The iliac crest is a curved, bony ridge lying below the waist. The anterior end of the crest is the anterior superior iliac spine. The posterior superior iliac spine is felt in a shallow dimple above the buttock, about 5 cm from the median plane. Number 4. The sacrum lies between the right and left dimples mentioned above. Usually, 3 sacral spines are palpable in the median plane. Number 5. The coccyx lies between the two buttocks in the median plane. Number 6. The spine of the seventh cervical vertebra or vertebra prominens is readily felt at the root of the neck. Higher up on the back of the neck, the second cervical spine can be felt about 5 cm below the external occipital protuberance. Other spines that can be recognized are T3 at the level of root of the spine of the scapula, L4 at the level of the highest point of the iliac crest, and S2 at the level of the posterior superior iliac spine. Number 7. The junction of the back of the head with that of the neck is indicated by the external occipital protuberance and superior knuckle lines. The external occipital protuberance is a bony projection felt in the median plane on the back of the head at the upper end of the knuckle furrow, running vertically on the back of the neck. The superior knuckle lines are indistinct, curved ridges which extend on either side from the protuberance to the mastoid process. The knuckle furrow extends to the external occipital protuberance above and to the spine of C7 below. Skin and fascia of the back. Position. Human being mostly lies on his back. Therefore, the skin and fascia of the back are adapted to sustain pressure of the body weight. Accordingly, the skin is thick and fixed to the underlying fascia. The superficial fascia containing variable amount of fat is thick and strong and is connected to overlying skin by connective tissue, and the deep fascia is dense in texture. Cutaneous nerves. The cutaneous nerves of the back are derived from the posterior primary rami of the spinal nerves. Their distribution extends up to the posterior axillary lines. The following points may be noted. Number 1. The posterior primary rami of the spinal nerves C1, C7, C8, and L4, L5 do not give any cutaneous branches. All 12 thoracic, L1 to L3, and 5 sacral nerves, however, give cutaneous branches. Number 2. Each posterior or dorsal primary ramus divides into medial and lateral branches, both of which supply the erector spinae muscles, but only one of them, either medial or lateral, continues to become the cutaneous nerves. In the upper half of the body, up to T6, the medial branches, and in the lower half of the body, below T6, the lateral branches of the posterior primary rami provide the cutaneous branches. Each cutaneous nerve divides into a smaller medial and a larger lateral branch before supplying the skin. Figure 5.2. Number 3. The posterior primary rami supply the intrinsic muscles of the back and the skin covering them. The cutaneous distribution extends further laterally than the extensor muscles. Number 4. No posterior primary ramus ever supplies skin or muscles of a limb. The cutaneous branches of the posterior primary rami of nerves L1, 2, 3, and S1 to S3 are exceptions in this respect. They turn downwards unlike any other nerve and supply the skin of the gluteal region. Dissection. Identify the external occipital protuberance of the skull. Draw a line in the midline from the protuberance to the spine of the last thoracic vertebra. Make incision along this line, figure 5.1. Extend the incision from its lower end to the deltoid tuberosity on the humerus, which is present on the lateral surface about the middle of the arm. Note that the arm is placed by the side of the trunk. Make another incision along a horizontal line from 7th cervical spine, vertebra prominence to the acromion process of scapula. Reflect the skin flap laterally. Muscles connecting the upper limb with the vertebral column. Features. Muscles connecting the upper limb with the vertebral column are the trapezius, figures 5.3a and b, the latissimus dorsi, the levator scapulae, and the rhomboid minor and rhomboid major. The attachments of these muscles are given in table 5.1 and their nerve supply and actions are shown in table 5.2. Dissection. Identify the attachments of trapezius muscle in the upper part of back and that of latissimus dorsi in the lower back. Cut vertically through trapezius 5 cm lateral to the vertebral spines. Divide the muscle horizontally between the clavicle and spine of scapula and reflect it laterally to identify the accessory nerve and its accompanying blood vessels, the superficial branch of transverse cervical artery and vein. Look for the suprascapular vessels and nerve deep to trapezius muscle towards the scapular notch. Cut through levator scapulae muscle midway between its two attachments and clean the dorsal scapular nerve, supplying the rhomboids and accompanying blood vessels. Identify rhomboid minor from rhomboid major muscle. Pull the medial or inner scapular border away from the chest wall for looking at the serratus anterior muscle. Define attachments of latissimus dorsi muscle. Table 5.1. Attachments of muscles connecting the upper limb to the vertebral column. Figures 5.4 and 5.6. Muscle, trapezius. The right and left muscles together form a trapezium that covers the upper half of the back. Figures 5.3a and b. Origin. Medial 1/3 of superior knuckle line. External occipital protuberance. Ligamentum knuckle. C7 spine. T1 to T12 spines. Corresponding supraspinous ligaments. Insertion. Upper fibers into the posterior border of lateral 1/3 of clavicle. Middle fibers into the medial margin of the acromion process and upper lip of the crest of spine of the scapula. Lower fibers on the apex of triangular area at the medial end of the spine with the bursa intervening. Latissimus dorsi. It covers a large area of the lower back and is overlapped by the trapezius. Figures 5.3a and 5.4. Origin. Posterior 1/3 of the outer lip of iliac crest, posterior layer of lumbar fascia, thus attaching the muscle to the lumbar and sacral spines, Spines of T7 to T12, lower foreribs, inferior angle of the scapula. Insertion. The muscle winds around the lower border of the teres major and forms the posterior fold of the axilla. The tendon is twisted upside down and is inserted into the floor of the intertubercular sulcus. Levator scapulae, figure 5.4. Origin. Transverse processes of C1, C2. Posterior tubercles of the transverse processes of C3, C4. Insertion. Superior angle and upper part of medial border up to triangular area of the scapula. Rhomboid minor, figure 5.4. Origin. Lower part of ligamentum nuchae, spines C7 and T1. Insertion. Base of the triangular area at the root of the spine of the scapula. Rhomboid major, figure 5.4. Origin. Spines of T2 to T5. Supraspinous ligaments. Insertion. Medial border of scapula below the root of the spine. Table 5.2. Nerve supply and actions of muscles connecting the upper limb to the vertebral column. Muscle. Trapezius. Nerve supply. Spinal part of accessory nerve. Branches from C3, C4. Proprioceptive. Actions. Upper fibers act with levator scapulae and elevate the scapula as in shrugging. Upper fibers of both sides extend the neck. Middle fibers act with rhomboids and retract the scapula. Upper and lower fibers act with serratus anterior and rotate the scapula forwards around the chest wall, thus playing an important role in abduction of the arm beyond 90 degree. Figure 5.7. Steadies the scapula. Latissimus dorsi. Nerve supply. Thoracodorsal nerve C6 to C8. Nerve to latissimus dorsi. Actions. Adduction, extension, and medial rotation of the shoulder as in swimming, rowing, climbing, pulling, folding the arm behind the back, and scratching the opposite scapula. Helps in violent expiratory effort like coughing, sneezing, etc. Essentially a climbing muscle. Hold interior angle of the scapula in place. Levator scapulae, nerve supply. A branch from dorsal scapular nerve C5, branches from C3, C4. Actions. Help in elevation of scapula. Steadies the scapula during movements of the arm. Rhomboid minor. Nerve supply. Dorsal scapular nerve C5. Action. Retraction of scapula. Rhomboid major. Nerve supply. Dorsal scapular nerve C5. Action. Retraction of scapula. Additional features of muscles of the back. Trapezius. Number 1. Developmentally, the trapezius is related to the sternocleidomastoid. Both of them develop from branchial arc mesoderm and are supplied by the spinal accessory nerve. Number 2. The principal action of the trapezius is to rotate the scapula during abduction of the arm beyond 90 degree. Clinically, the muscle is tested by asking the patient to shrug his shoulder against resistance. Structures under cover of the trapezius. A large number of structures lie immediately under cover of the trapezius. Some of them are shown in figures 5.5 and 5.6 and are listed below. Muscles. Spinalis capitis, spinalis capititis, levator scapulae, inferior belly of omohyoid, rhomboid minor, rhomboid major, supraspinatus. Infraspinatus, latissimus dorsi, serratus posterior superior. Vessels. Suprascapular artery and vein. Superficial branch of the transverse cervical artery, superficial cervical, figure 5.5, and accompanying veins. Deep branch of transverse cervical artery, figure 5.6, dorsal scapular, and accompanying veins. Nerves. Spinal root of accessory nerve, figure 5.5, suprascapular nerve, C3, C4 nerves, posterior primary rami of C2 to C6 and T1 to T12 pierce the muscle to become cutaneous nerves. D. Bursa. A bursa lies over the smooth triangular area at the root of the spine of the scapula. Latissimus dorsi. This is the only muscle which connects the pelvic girdle and vertebral column to upper limb. It possesses extensive origin and narrow insertion. The latissimus dorsi develops in the extensor compartment of the limb. Thereafter, it migrates to its wide attachment on the trunk, taking its nerve supply, thoracodorsal nerve. Along with it, it is also called a swimmer's muscle. The latissimus dorsi is tested clinically by feeling the contracting muscle in the posterior fold of the axilla after asking the patient to cough. Triangle of auscultation. Triangle of auscultation is a small triangular interval bounded medially by the lateral border of the trapezius, laterally by the medial border of the scapula, and inferiorly by the upper border of the latissimus dorsi. The floor of the triangle is formed by the sixth and seventh rib and sixth intercostal space and the rhomboid major. This is the only part of the back which is not covered by big muscles. Respiratory sounds of apex of lower lobe heard through a stethoscope are better heard over this triangle on each side. On the left side, the cardiac orifice of the stomach lies deep to the triangle, and in days before X-rays were discovered, the sounds of swallowed liquids were auscultated over this triangle to confirm the esophageal tumor. Figure 5.3a. Lumbar triangle of Pettit. Lumbar triangle of Pettit is another small triangle surrounded by muscles. It is bounded medially by the lateral border of the latissimus dorsi, laterally by the posterior border of the external oblique muscle of the abdomen, and inferiorly by the iliac crest, which forms the base. The occasional hernia at this site is called lumbar hernia, figure 5.4. After completing the dissection of the back, the limb with clavicle and scapula is detached from the trunk. Dissection. For detachment of the limb, muscles which need to be incised are trapezius, levator scapulae, rhomboid minor and major, serratus anterior, latissimus dorsi, and sternocleidomastoid. The sternoclavicular joint is open to free clavicle from the sternum. Upper limb with clavicle and scapula is removed en bloc. Facts to remember. Trapezius is a shrugging muscle supplied by the spinal root of 11th nerve. Trapezius and serratus anterior cause 90° to 180° of abduction at shoulder joints. Clinico-anatomical problem. A poor young adult felt multiple nodules in the region of his neck above the clavicle. A lymph node biopsy was advised from right side of his neck. A few days after the biopsy, he was unable to shrug his right shoulder. Why was the biopsy advised? Why is he not able to shrug his shoulder? For proper diagnosis and treatment, a lymph node biopsy was advised from the posterior triangle of neck. The spinal root of accessory nerve got injured during the biopsy procedure. This nerve supplies trapezius muscle responsible for shrugging of the shoulder. Due to the injury of spinal root of 11th nerve, he is unable to shrug his shoulder. So this was the chapter. Happy reading.